The most important cause of kidney cancer is tobacco. Either smoking or chewing of tobacco increases the risk of kidney cancer occurrence by about 2.5 times than those who do not consume tobacco. And this relation is dependent on the dose as well as the duration. So the more amount of period we consume tobacco, the higher is the risk of getting kidney cancer. Also, with reduction in the tobacco consumption, the risk of kidney cancer decreases over time. The second most important risk factor is obesity. With increase in the BMI above normal, by each point increases the relative risk of kidney cancer occurrence by 1.1 times. Apart from this, there are some other risk factors as well, which includes hypertension, exposure to certain chemicals, especially which contains cadmium or asbestos, and exposure to certain drugs like NSAIDs. Apart from that, retroperitoneal radiation and end-stage renal disease also confer kidney cancer risk. Earlier, kidney cancer used to present with symptoms because it used to be presenting in the advanced stage. But nowadays, because of widespread use of abdominal imaging like ultrasound, CT and MRI scans, kidney cancers are often diagnosed in the pre-presentation time or pre-presentation stage, usually in the earlier stages of the disease. So in this case, patients usually do not have any symptoms and they usually get detected by the abdominal imaging a small kidney cancer or a small renal mass. If kidney cancer grows, it can cause symptoms, especially when it grows and it surrounds or invades the adjacent organs. So usual symptoms include bleeding in urine, which is hematuria, pain in the area of the kidney, which is flank pain, and sometimes patient or the examining clinician can palpate a mass, which is called the lumbar mass. The presence of these three together is called the triad or the classic triad or the lethal triad of kidney cancer. Apart from this, patient may have symptoms which are called paraneoplastic syndromes, which can occur, which are very common in especially the advanced stages of kidney cancer, in which patient can have anemia, weight loss, fatigue, hypercalcemia and raised ESR.